Here we go. Okay, next slide.
Babkin palmamento. This is the hand-mouth reflex that gets us ready for eating and eventually speech. So it emerges the 9th week in utero, and it should be integrated about 3 months. You'll notice this active in a lot of children or even adults. I was watching Dancing with the Stars and Mark Cuban. When he's dancing, his tongue is sticking out. And that means, and as you're moving, your tongue is moving. That means the reflex isn't integrated. We still shouldn't have that connection between the movement and whatever task we're doing. We see children writing or reading and the tongue is moving. I was on a bus in the Netherlands and there was this sweet little nun, and she would suck a straw and then her tongue would just move all over the place. It was such a strong example of what can happen when Babkin doesn't integrate. Or maybe the mouth is just kind of hung open most of the time. They have to think about to close it, is another indicator that Babkin isn't integrated. So that's when you can kind of visually see some of the characteristics. This is really important for the child when it's beginning nursing. It might be a person who is hungry all the time because they're not getting the nutrients from their food because this is so active, and it also can be someone we see a lot of food allergies in. Most importantly, we're looking at speech, stuttering, things like that when we're looking at Babkin. Might be a person with phobias, tongue sucking, nail biting, things have to go into the mouth. And as I mentioned, involuntary movement of the mouth and tongues is just going. I'm sure Mark Cuban did not know that his tongue was moving while he was dancing. Another really important characteristic of this is that it actually increases myelination of the nerves. So when you're working with someone with multiple sclerosis or any other of the autoimmune diseases or things that cause damage to the myelin sheath, which is the myelin sheath is actually a white coating that covers the nerves that helps the nerves transmit more efficiently. So when that's damaged or not there, then the nervous system has some pretty severe problems. So important one to focus on and increase if you're working with someone that has a genetic condition or anything that affects nerve myelination. Another condition we look at with this is anyone who has TMJ problems. When we're assessing, we're actually finding the joint and seeing if pressing on the thenar muscle causes tension in the mandibular joint up here for the TMJ. And so we're looking at that when we assess it. And so if you ask someone if they have problems with TMJ and they do, then you know Babkin's going to be really essential for that person. Okay, so now we'll show the protocol and the assessment for Babkin palmamento. That is the hand-mouth reflex. So I'm going to go right here on the thenar muscle, and I'm going to go first of all up the palm. And what I'm watching for is movement in the lip, the mouth to move right there. So when it's active, when you go like this, you might see that. And my next assessment is I'm going to come right here, and typically I wouldn't reach over. I would walk around to this side. It's not good etiquette, especially to reach over the body, cut off communication. So always important to be on the side of the body that you're working on for most things, especially on the upper body. So the next thing I would do is I would check right here about TMJ and hold right there, and then I'm going to press. And if I feel tension there, then I know that this reflex is active. Another good way of assessing this reflex is, especially if you have a child, is watching how they write. If they write, their tongue is going like this, or if their mouth is open when they're writing, or when they're moving, then you know that the Babkin palmamento is still active. So again, I'm pressing on the thenar muscle. After I check this for tension, press right here, and I feel if there's any tension. Or if it's an adult, I can say, do you have problems with TMJ? And then I know Babkin's going to be active. So then I would just come over to the other side, and I'm going up the side of the palm. How did that? Okay, so that's causing her some stress. So I know there's an element of Babkin active. Okay, and on this hand. So what? Let's check and see if we can feel that when we do our second assessment. Okay. And I can feel some tension in this side where I didn't the other side. So it looks like her right Babkin is just a little bit active. So what we're going to do for that one is, for this one we can grab our Spiro and laser back on. So I'm going to put this laser right here on the thenar muscle, right there, and we can just let it sit there. Then I can take my other laser and put it right there. Let's turn your hand over. Then I'm going to come up the inner part of the arm. And I will do this one a bit longer too, typically about 8 times. This one's really good for speech. It's the hand-mouth reflex for swallowing, chewing, and even helps professional singers relax their muscles in their mouth and have a better range of notes they can hit. Now we just move over to the other side. And again, put the lasers in the same position, take my Spiro and run it up. Now if I don't have a Spiro, I can do both sides at the same time if I want. And I hold here for 15 to 20 seconds. Then I slowly move up. Always make sure your traveling is really slow. And then I stop on the point and I hold there for 15 or 20 seconds. And again, I would repeat that at least 8 times. And that's the Babkin Palmamento protocol and assessment.